IPF is a new hematology parameter, now a reportable parameter. Before we used to use the traditional methods, all thrombocytopenia patients, we had to do the slide review, and which is time consuming, tedious, cause a lot of TAT failures. Now we could have the optical platelets as well as immature platelet fraction as well as other platelet parameters in severe dengue cases as compared to non-severe cases. Also, IPF rises 2 to 3 days earlier than the actual platelet rise, which shows the bone marrow recovery or activity has occurred. So IPF tells that the recovery has already started, and which can unnecessary transfusions can be stopped because of the platelet recovery, which can be predicted earlier due to this marker. I would like to tell the story of a small child who was admitted in an ICU and had severely dropping platelet counts and severe thrombocytopenia, and in spite of multiple transfusions, the platelets refused from the critical values. The parents were very anxious, and every time the sample came, just to know the platelet counts and the fact that the platelets are rising, we were tracking the IPF of this patient. Once we saw that the IPF is climbing up, we informed the clinicians that looks like now the IPF is climbing up, so chances platelets of this patient will climb up in another 2 days. Initially, the clinicians were a little hesitant on stopping the transfusions, but once the platelets stabilized, they were convinced. The transfusions to this patient was stopped. Ultimately, after 3 days, the platelets did climb up and the child recovered. The parent, once the child became all right, came back, who was always having this tense, anxious face. First time I saw them smiling, and then they came and thanked us effort that the lab did for platelet recovery. It was very nice to see the parents smiling.